Is an instant erection only possible with expensive drugs, or is there another way that not many people know about? Soon, you'll hear about a simple tool that can work instantly, but there are details that doctors rarely disclose. Many men, especially those over 60, have tried pills, but their erections remain unstable, sometimes even causing side effects like heart palpitations that cause anxiety. For those with high blood pressure or other underlying conditions, medication options become even more limited, adding to their frustration instead of providing relief. Some medical reports indicate that around 30 to 40% of patients do not achieve satisfactory results from PDE5 drugs. That's not a small number, as millions end up feeling trapped without a truly reliable solution. The hope of regaining control turns into disappointment, and ironically, dependence on medication makes many men feel they've lost their masculine identity. In health psychology, this loss of control can worsen self-confidence and further strain an already fragile condition. The situation becomes more complicated because many general practitioners focus solely on prescribing medication, as it's considered the fastest and most practical route. However, urology specialists have long recommended other safe and effective options, though these are rarely explained in everyday practice. This information gap leaves patients feeling like they have no options, when in fact, solutions do exist. It's no wonder many older men think they've run out of chances, even though that's not necessarily true. The question now is, if drugs often fail, side effects are frightening, and safe alternatives are rarely discussed, what real options are actually available? How does this tool work? Why is it instant? And is it still effective after age 60? Soon, all of this will be revealed, and that's where the surprise lies that has been so rarely uncovered. After seeing how many men are disappointed because medications often fail, let's shift our perspective to a more promising direction. The question is, what other reliable paths are there? Age is clearly not an absolute reason, as the body can still respond to stimulation if blood flow is directed correctly. Surgery does exist, but it's certainly not the only route, especially for those who want to avoid major risks. In fact, there's a simple technology that has long been used in urology clinics. So, how does this mechanism actually trigger an erection in just a few minutes? Have you ever imagined an erection appearing in 2 minutes, without pills, just with a simple trick of the body itself, and soon we'll uncover why this method can feel so instant, even when age makes you doubt. This device is called a vacuum erection device, or VD, and it medically works by creating negative pressure around the penis. When the tube chamber is pumped, blood is drawn into the erectile tissue, causing the penis to harden without chemical assistance. This mechanism is like forcing blood flow in, yet still follows the body's natural physiological laws. In clinical practice, results can be seen in just 2 to 3 minutes, a duration almost impossible to achieve with medication if the body doesn't respond well. Once an erection is formed, patients usually use an elastic ring at the base of the penis to hold the blood in and prevent it from flowing out immediately. This ring acts like a gatekeeper, maintaining stable pressure so the erection can be sustained during sexual activity. Its use is considered safe, as the ring is only worn temporarily and then removed afterward, allowing circulation to return to normal. Medically, this principle aligns with how the body maintains a natural erection, only assisted by a simple physical mechanism. That's why this device can be used repeatedly, averaging 2 to 3 times a week, without disrupting other organ functions. Many men initially worry that using such a device could damage tissue or make the body lazy in forming its own erections, but research shows the opposite. By regularly forcing blood in, the erectile tissue remains elastic, which is important especially for those who rarely experience spontaneous erections. In post-prostate surgery rehabilitation, for instance, VD is often used not just for sexual intercourse, but also to train the tissue to avoid stiffness. An added benefit is that patients feel they still have control over their bodies, a psychological factor that's equally important in recovery. So, it's not an exaggeration to call this device not just an instant solution, but also a form of long-term therapy. Interestingly, the sensation of an erection produced by VD is slightly different from a natural erection. There are differences in tension or ejaculation sensation, but this does not diminish its primary function for penetration. From the partner's perspective, most report that these differences can be overcome with communication, as what matters more is the continuity of intimate activity itself. It's clear here that this device not only activates the body's engine, but also restores confidence. Soon, we'll see how the effectiveness of this device holds up in older age, even in patients with medical conditions that often cause medications to fail. Can this simple device still work in their 70s, or even for diabetic and post-prostate patients? The answer often contradicts what many men assume. In many urology clinics, data shows a success rate of up to 90% in men with erectile dysfunction, even after prostate surgery. This means that even if hormones or nerves are disrupted, this physical mechanism can still work because it doesn't rely on chemical pathways that often weaken with age. In fact, patients with diabetes or those taking erectile inhibitors still benefit because VD directly directs blood flow to the erectile tissue without involving complex hormonal processes. Simply put, this device bypasses the door often closed to drugs, keeping the chance for an erection open. Indeed, VD doesn't add permanent size, but it provides enough quality for satisfying sexual activity. This is very meaningful for many men because what is maintained is not just physical function, but also confidence and emotional closeness with their partner. Many men in their 70s initially think their bodies are too old to respond. However, it is in this group that VD often provides real results because its principle works directly on blood flow. Of course, there is adaptation. Sensations may differ, or tension is not always identical to a natural erection, but the main benefit is still achieved. With good communication with their partner, these differences are not obstacles, but adjustments that can be accepted. With this understanding, you know that age and medical conditions are no longer barriers to achieving a satisfying erection. If pills seem more practical because you just swallow them, why do many men still choose VD? The answer will soon make you think twice. The key lies in a different way they work. Pills are only effective if there is a hormonal response, while VD bypasses that pathway and works directly on blood flow. That's why, when drugs fail or cause side effects on the heart, VD can still be relied upon. The first step: understand that VD does not cause systemic effects, meaning it does not interfere with blood pressure or the function of other organs, so it is safe for those with a history of heart disease. The second step: recognize that mild discomfort at the beginning of use is usually just adaptation, like a body learning to swim for the first time. With short practice, that feeling will decrease. The third step: if there is an objection that pills are more comfortable because you just swallow them, realize that this false comfort can be risky for the body, while VD provides direct control that is safe and consistent. This way, you know VD remains the top choice when medication fails or poses risks. Many men ask whether this device is truly an official medical therapy or just a toy. Many assume VD is merely a gimmick sold over the counter, but the reality is quite different. Since 1997, authoritative bodies like the FDA in the United States have officially approved VD as a medical therapy for erectile dysfunction. This means the device is not an experiment, nor merely a commercial product, but part of internationally recognized guidelines acknowledged by urologists. This legal fact is important because myths about strange devices often deter men from trying it, even though this therapy is safe, effective, and recognized. Let's talk about practicality. Many people think using a physical device must be more cumbersome than taking a pill. However, when used correctly, VD actually gives the user full control. You don't need to count the hours of medication effectiveness, worry about interactions with food or other drugs, and you can decide when to be intimate without waiting. What about the cost? This is the part that often surprises people. A medical VD kit is usually equivalent to the cost of prescription medication for several months. Indeed, premium versions with more durable materials can be more expensive, but they offer long-term investment value. Many patients report that one device can be used for years, while medications must be purchased repeatedly. When calculated in terms of cost per erection, VD is actually more economical. In some countries, health insurance even covers part or all of the cost, given its status as an official therapy. So, comparing prices without considering the time frame is a common mistake. In the long run, VD is more economical and provides financial peace of mind. Now, let's clear up some common myths. First, the myth that VD can permanently enlarge the penis. Medically, this is not true. VD only triggers blood flow to create an erection, returning the size to a healthy, normal condition, not adding permanently. Second, the myth that using this device makes the body lazy for natural erections. In fact, the opposite is true. VD is often used as rehabilitation therapy post-prostate surgery to maintain tissue elasticity, prevent fibrosis, and preserve the body's ability to form spontaneous erections in the future. Third, the myth that partners will reject it due to different sensations. Research shows that the majority of partners actually accept it well, especially when communication is open, because the main focus is not identical sensation, but the continuity of intimate life itself. One thing to emphasize, FDA approval and international guidelines provide evidence that VD is a real medical therapy, not just an experiment. Its safety has been tested in clinical studies, including in patients with heart disease, diabetes, and other conditions that make pills risky. This legality closes the gap of doubt, while also providing assurance that this device can be used long-term safely. When a therapy has lasted decades in guidelines, it means its clinical evidence is strong, and its benefits have been tested in various real conditions. So, if you're still torn between myth and fact, imagine the position of a man who has tried medication without results, then discovers that with VD, he can regain control of his body. Practicality is in hand, costs are more economical in the long run, and its safety is guaranteed by official regulations. With this understanding, you know VD is a safe, practical, and medically legitimate investment. A common question after learning that VD can trigger an instant erection is, if the result is only due to the device, does this mean it can provide a permanent cure? This concern is understandable, as many men hope for a one-time solution that completely fixes the body. Medically, erectile dysfunction is usually related to vascular or nerve issues, which cannot be restored with just a physical mechanism. So the honest answer is, VD does not offer a permanent cure, but it does provide an instant solution that is still highly valuable. Let's take a closer look. In post-prostate surgery rehabilitation, for instance, patients often lose the ability for spontaneous erections because the involved nerves are disrupted. Urologists use VD not to cure in the sense of restoring nerves, but to keep the erectile tissue elastic and prevent hardening due to lack of blood flow. With regular practice, the body remains ready if nerve recovery occurs at some point. This means that although it is not a permanent therapy, VD plays a crucial role in maintaining organ function and tissue readiness. With this understanding, you know even a simple device can maintain vital functions longer. From the start, you might have assumed only expensive drugs provide instant erections, but it's now clear that VD delivers real results even in older age or with complex medical conditions. You also know that while pills seem convenient, VD is still chosen because it's safe, immediate, and not hormone dependent, while its effects are temporary yet proven to keep tissues responsive. With all this discussion, it's clear that it's not age, drugs, or surgery that determine the outcome, but your decision to use safe, official medical therapy. Your new identity is a wise man who chooses control, maintains intimacy, and enjoys life calmly. If after hearing all this explanation you still have doubts, that's normal, because the decision touches on something very personal. However, the first step doesn't have to be big. Just start by seeking more information from a urologist, as that's where you'll get safe medical guidance. If you feel ready, consider trying VD with medical guidance, so the use is more comfortable and the results are as expected. Remember, changes in quality of life often come from small, brave steps, and this decision can be an important turning point. If you liked this video, hit like, and if you have questions, ask them in the comments section. If you want more practical insights about men's health, support us by subscribing to this channel. Thank you for watching. See you in the next video.